So the next award to be presented is the Telstra Health ACRRRM RDAA Rural Registrar of the Year Award. This award is offered to the ACRRRM Registrar who has demonstrated outstanding leadership and advocacy in the field of rural and remote medicine. I'm excited to announce that for the first time, there are 2 amazing registrars that are being presented this award tonight. And I'm pleased to say that the recipients of this award will be announced by Ruth.
So the Rural Registrar of the Year Award for 2015, the 2 registrars are, they both have the same first name. So it's Dr. Sarah Farlow and Dr. Sarah Kaufman. Congratulations. Please come up. And I'll just... Oh, no, that's okay. Yeah. And great. And if I can say a few words. Firstly, Dr. Sarah Farlow has made a real change to the hospital training environment and is a great advocate for rural remote medicine. She's very compassionate and dedicated registrar. Dr. Sarah Farlow is a postgraduate Year 4 and current TMT GP registrar working in a PHO role at Mount Isa-based obstetric department, and is currently undertaking her advanced skills training towards ACRRM fellowship. Originally from Proserpine, Queensland, Sarah attended JCU to study medicine in Townsville and Darwin. Sarah was fortunate enough to complete 2 PPP rotations. All these acronyms are a little bit strange to me, I have to say, in PGY2 on Thursday Island and Proserpine, solidifying her commitment and enthusiasm for remote medicine and living. Sarah is also a Registrar Liaison Officer for Tropical Medicine Training and has a strong desire to expand her clinical skill sets and provide high-quality medical care to rural areas. Now, Sarah's already there, so Sarah's already stepped up to respond. So, Sarah, if you could please respond. Sarah Farlow. Congratulations.
Wow. I'm incredibly privileged and honoured to receive this award. I don't know where the other Sarah got to. A big thank you to Telstra Health for your sponsorship and the RDAA and ACRRRM for this opportunity to gain further education and network with so many inspiring clinicians and people from around the country and abroad. I'd like to take this opportunity to also thank the Rural Doctors Association of Queensland for their continuing professional and personal support throughout my training. I'd like to thank my GP and hospital-based supervisors over the years, James Cook University, for their promotion of rural health and acquisition of skills needed to embark on this journey into the rural workforce, and also Tropical Medical Training for providing the support and many opportunities throughout my pre-fellowship years in communities in which myself and fellow registrars call home. The adventure, as I like to call it, in rural medicine really started probably from my first year in a medical school. Being rural always felt like the best kept secret to me. A career that has so many open doors behind which have so many rewards, namely the patients and families I feel blessed to work with, and as well as the endless mentoring from inspiring rural doctors who have formed the backbone of what is widely recognised and acknowledged now as the rural generalists. I hope my generation can continue this legacy and provide all as many of you in this room do every day in your communities. Thank you and cheers, and go the Cowboys.
And Sarah, I happened to see your video and I thought that was brilliant. So those of you who haven't seen Sarah's video on YouTube, it's a really good thing to see and something that I'm going to play to our medical students. I would now like to talk about Dr. Sarah Kaufman. Sarah Kaufman has been engaged on a full-time basis at Catherine Hospital again more acronyms, as an ACRRM registrar since January 2014. In this time, she has worked in a variety of roles, including an emergency department officer, a maternal and child health role that included first on-call obstetrics responsibility, and in 2015 as a medical registrar undertaking advanced skills training and in adult internal medicine. Sarah joined the ACRRM training program in 2012 and worked as a registrar in general practice and in Queanbeyan District Hospital Emergency Department. The remainder of her registrar training has been at Katherine Hospital in Northern Territory. In 2014, she worked as a maternal and child health medical officer, a role requiring sound clinical judgment and procedural capacity. It involved responsibility for all paediatric and neonatal hospital patients with remote paediatric supervision and obstetric medical officer responsibility for around 300 births per year. That's a lot. Her calm, compassionate and authoritative leadership constantly inspired the confidence of staff and families. In 2015, she brought a mature and holistic approach to adult medicine, showing how valuable ACRRM registrar can be to acute inpatient medical care teams. Sarah has worked hard to extend her skills beyond the standard curriculum, following a learning plan designed by her supervisors and driven by her own ambition. I would now like to present the award to Sarah.
I wasn't going to say anything, but there's a bit of peer pressure to at least be grateful and stand up here and say thank you, which I am very grateful. I mean, we all just do what we love, and I love what I do, and I'm just very thankful to be thanked for doing that. So there's probably one thing that always stood out when I was a medical student. I loved to ask all my supervisors and doctors that were in front of me why they chose to do what they did. You know, why were you a surgeon? Why are you a GP, etc. And most of them kind of fitted into three categories. It was either right place, right time, wrong place, wrong time, or a mentor that kind of guided them along the way. And for me, it's really the latter. So there's been some very key people who have just shone as examples of the kind of doctor I'd like to be. So I'll just quickly mention their name. None of them are here today, but in Queanbeyan, Dr. Peter Davis, who delivered my 4 children. GP Obs, so go GP Obs. Dr. Jeannie Ellis, who's doing her advanced diploma in obstetrics, but she ran the ED that I worked at. And Dr. Philip Gray, who I worked in general practice with, who had a real grasp of adult internal medicine and kind of encouraged my sense of curiosity and wanting to know more on that sense. And then in Katherine, I'm very lucky to work in Katherine. It's just an amazing place. And again, 3 people that stand out are my supervisors there, Louise Harwood, the DMS, Paula Ferguson, in charge of the ED, and especially Dr. Simon Quilty, who's a physician, a general physician, who has set the tone at the hospital for one of a very high standard, and I'm very, very lucky to work with them all. And finally, I'll thank my husband Bill, who, without him, obviously there'd be no 4 children, and my adventures wouldn't be half as exciting and crazy without him, so I'm very grateful, Bill, and thanks for coming. Thank you.